Welcome. My name is Peter Strong. I'm a professional online therapist and I offer psychotherapy via Skype that's based on mindfulness therapy. I offer online MBCT or mindfulness-based cognitive therapy. The style of therapy that I've developed is called Mindfulness Therapy, which is based on MBCT, but takes it a step further. So mindfulness is a very effective tool that's having tremendous impact on psychotherapy and on wellness in general. It's a way of developing a conscious awareness of what's happening in the mind and establishing a relationship that's non-reactive with whatever thoughts or emotions arise in the mind. So we can see a thought, we can become aware of it, but not become identified with it or become reactive toward the thought with grasping or aversion. So we can hold thoughts and emotions in our awareness without becoming overwhelmed by them. And that's the primary contribution of mindfulness. The CBT version takes this a stage further and then begins to help you evaluate these thoughts and judge if they are rational or not. Most of the time we blindly accept generalizations and black and white thinking and so on that are not really real. They just become thought patterns that we become attached to and that create problems. So rumination in depression is an example of that. Catastrophizing and excessive worrying are big factors in anxiety as well, or OCD. So challenging the thoughts and then, of course, trying to replace them with more positive and functional thoughts is the primary objective of CBT. So mindfulness is about not becoming seduced, if you like, by reactive thoughts, and CBT is about looking at how to change those thought patterns to more positive ones. Now, mindfulness therapy, which takes MBCT a stage further, looks at another very important factor that sometimes is overlooked, and that is the emotional charge of thoughts, the emotion itself. So many intrusive thoughts, particularly in depression and anxiety and OCD, have very strong emotional charges. It's very difficult to simply dismiss those thoughts because they are so intense emotionally. So working with that emotional charge is the main contribution of mindfulness therapy. This is a system that I have been working on for over 20 years now. So the same kind of ideas apply. We first of all cultivate mindfulness, which means recognizing those emotionally charged thoughts, but then establishing a relationship based on mindfulness, non-reactivity with those thoughts, but then looking at a response to those thoughts that can help them heal effectively. So mindfulness therapy is very focused on healing. So what is it about that thought that has such an intense emotional charge that keeps it there? It is clearly stuck, essentially. And we need to help free that thought of that emotional charge in order for it to resolve and go away. So that involves establishing another aspect of mindfulness, which is called metta, M-E-T-T-A, in Buddhism. This is a quality of friendliness or loving kindness or compassion. We need to develop a compassionate relationship with our emotions if they are to heal. And that's a very, very important part of mindfulness therapy, is developing this internal compassion towards our own emotions and thoughts. If we can hold them in this way and help them heal by our compassion and our friendliness and our interest in their welfare, then those emotions will heal. And when the emotions heal, then that takes away the emotional charge of those intrusive thoughts, and they tend to dissipate and quite naturally become replaced by more positive thoughts, because there's nothing keeping them there. They are no longer stuck in the mind. So this is a brief overview of mindfulness therapy and online MBCT. If you'd like to learn more, do please go to my website and reach out to me by email if you would like to explore the possibility of doing online MBCT with me. Thank you.